Severe neck pain, a signal of something serious? The report of a young woman who had undergone a stroke after a visit to a chiropractor last spring. Reinvigorated discussion on a potentially crippling but known as a cervical artery dissection. It is a tear in the lining of one of the main arteries that carry blood to the brain. See image. Some practitioners commonly use quick, jolting neck motions, or adjustment cervical manipulative therapy, which may trigger a reduce of. After a visit to my practice, I have been working with lots of patients who had a stroke when being adjusted on the chiropractor's table or having just left the Dr. Ruth Rost, an associate professor from the Harvard Medical School and the chief of stroke services at the Harvard-affiliated Massachusetts General Hospital. However, a host of other activities and situations that cause sudden, jerky neck movements can also cause tears in the delicate arteries in the front and back of the neck, she says. The activities she worries about the most? Bungee jumping, riding a roller coaster, and whitewater rafting are at the top of her list. Dissections have also been reported after strenuous weightlifting, high-intensity workouts, and however, a host of other activities and situations that cause sudden, jerky neck movements can also cause tears in the delicate arteries in the front and back of the neck, she says. The activities she worries about the most? Bungee jumping, riding a roller coaster, and whitewater rafting are at the top of her list. Dissections have also been reported after strenuous weightlifting, high-intensity workouts, and however, a host of other activities and situations that cause sudden, jerky neck movements can also cause tears in the delicate arteries in the front and back of the neck, she says. However, there are other ratepayers that will advertise these motions could cause cracking in fragile necks, since the activities she worries about, bungee jumping, riding a roller coaster, and whitewater rafting are at the top of her list. Dissections also have been reported after strenuous weightlifting, high-impact workouts, and head-whipping dance routines can cause unsafe stretches and movements executed when yoga is in session can also make a person susceptible to an aneurysm. A horseback riding accident could also cause it. To help prevent this problem, ask your hairdresser for a neck extension, a small cushion that props up your neck to prevent neck strain. In many countries, the activities of millions of individuals take place constantly without causing them any. Cervical artery dissections are uncommon, relatively uncommon, about 1 in every 100,000 individuals every year. Although the general assumption is that cervical artery dissections are quite rare, it is in fact more common than we believe. Many believe that it's typically the body that is repairing the destruction caused by these dissections, but in fact, in most cases, the body repairs the damage on it. The most typical cause of cervical artery dissection is in young adults. This is due to the long-term effect of cumulative physical activity, the amplified risk, and the blockage of brain blood vessels that results from having excess fat in your arteries and from accumulating plaque in the arteries of the aorta often leads to other strokes, such as strokes that arise from narrowed arteries. The likelihood that stenosis or impaction will lead to a stroke increases with age. 2 arteries that run up one side of the neck, the carotid arteries, 2 others on the other, the vertebral arteries, and the other 2 at the back of the neck, the subclavian arteries, are all. A tear in the layer of an artery known as a cervical artery dissection permits blood to flow between the layers of the artery walls lining the body's natural physiological reaction. The formation of a clot to plug the hole may actually bring on a cerebral embolism if a bigger clot blocks blood flow through the artery or breaks off and lodges in a major cerebral. Either of these conditions could lead to a stroke. The unusual, persistent, and severe pain in the neck area that occurs after a stagnation in the cervical artery is generally one of the symptoms parents witness. With a carotid dissection, the pain spreads cordially down the sides of the neck toward the forehead, eye, cheek. A tear in the vertebral artery causes a sudden sharp pain in the back or base of the skull, and it can bring about stroke symptoms like dizziness, double vision, jerky eye movements. If you experience any of that pain combined with stroke symptoms, like those listed below, call 9. However, keep in mind that vertebral artery dissection symptoms can develop days, weeks, months after the onset of neck pain due to a dissection of an artery. Survivors of vertebral artery dissection may seek care for neck pain from a chiropractor. Chiropractors will establish that they did not cause the injury on their own in the first place. But neck manipulation can make your affliction worse, either by worsening the joint tear or displacing a clot, which may trigger a stroke, states her recommendation. No matter what, don't permit anyone to push, squeeze, move them, as it can worsen the condition.